Hi, this is Dr. Marc Adajar from XSculpt. I'm one of the XSculpt surgeons, and I wanted to go over your post-operative instructions after your ChestSculpt Gynecomastia correction procedure. Congratulations, it's all finally done. However, in order for your results to be optimal and to prevent any type of problems, it's super important that you follow the instructions that I'm going to go over in these next couple of minutes. Okay, so when you wake up from surgery, you will likely have some sort of compression vest on. It's usually a black vest that has a zipper or some clips along, possibly with some foam. It is important that you wear this vest and the underlying foam for as much as possible during the day and night for 24 hours until your first post-operative visit within the next 4 or 5 days or so. You can take them off to shower after the first 24 hours, but as soon as you're done showering, replace the foam if you have it, as well as the compression garment. Now, this compression garment or vest, we want you to wear ideally for a minimum of 2 weeks after the surgery. However, the more you wear it, the better your overall results will be. Maximum about 4 to 6 weeks, but an absolute minimum of 2 weeks. Ideally around 4 weeks is what we want you to wear it for. But again, the longer you wear it, the better your results are going to be. This compression vest is really important for several reasons. Number one, to help prevent some swelling. Number two, to control some bruising. And number three, to help the skin elasticity so that your skin doesn't sag. So the more you wear this vest, the better. Now, after you stop wearing the vest, it's important to wear some sort of compression shirt, like one of those Under Armour compression shirts. You should get a half a size smaller than you normally wear, and wear that once you decide to stop wearing the compression vest. And that compression shirt should be worn for a minimum of 6 weeks after the surgery. Again, the longer you wear some sort of compression after the surgery, whether it be the vest or the Under Armour compression shirt or a similar brand, the better your overall results will be. You also, it is possible that if you wake up, you may have a drain. We only put these drains when there's a large amount of volume that's removed and we're concerned about fluid buildup. The drain will often exit out of your armpit or below the chest. Now, it's important that you empty these drains every 24 hours and record the output, which the nurses will show you before you leave. Because based on the amount that's coming out, that will determine when these drains can come out. I know the drains can be a little bit annoying and somewhat irritating, but again, it's a necessary evil to make sure that you don't develop any complications and that you have a best cosmetic result as possible. The drains will be removed as soon as possible, but unfortunately, we don't want to remove them too early, or else we'd have to put them back in. So it's really important that you empty these at least every 24 hours, record the output, so we have an accurate measurement and so we can remove them appropriately. Now, you will have sutures that we will remove at your first post-operative visit. If we remove the gland from behind your nipple, there are dissolving stitches there, but you'll see some little tails that we would just trim off in the office, and you may have little incisions either in the shoulder blade area, or not the shoulder, the deltoid area, or here beneath the chest, and we can remove those in our first post-operative visit. Often we leave those stitches in there and a little bit loose so that your chest can drain any residual fluid from the surgery. So sometimes we don't close them completely, but we leave these removable sutures that we can remove at the first visit. Okay. If you haven't been given them already, you will have a prescription for antibiotics that you should take for about that you will take for about 5 days. Make sure you take those antibiotics because we want to make sure you don't develop any type of skin infections. You will have some pain medication for you should you need it. If you can get away with extra Tylenol, that would be great. But if the pain is too much or the discomfort is too much, then take the prescribed medication. Often, I would recommend you take it before you go to sleep so you can get a good night's sleep. But make sure that you take them only when you need it and not too often. You'll also have a prescription for some anti-nausea medication, which can happen after anesthesia and also can happen with some of the pain medication. So take that anti-nausea medication as you need it. Okay, so some of the things that we really want to watch out for, especially in the first couple days after surgery, is any type of extensive bruising. Now, you can expect some bruising. That's not abnormal, but if the bruising is enough where the whole skin is like a real dark black and blue on a large amount of area, we need to know that immediately. That may be what we call a hematoma, which is a collection of blood. Often we can just monitor these, but if the hematoma is large enough, it may require an evacuation of that collected blood in the office. So that's one of the things we want to watch out for. We also want to watch out for what we call seroma formation, which is similar to hematoma, except it's not blood, it's just fluid, a lot of times dissolved fat or some of the fluid we use during the surgery. If that occurs, it usually is like an area of swelling underneath the nipple or around the chest, and it's often taken care of just an aspiration in the office. We also want to watch for infections, which is, you'll have an area of redness or tenderness or blanching of the skin at the area of surgery. That's not very common. None of these are very common at all, but it's things that we want to watch out for, and that's why we give you, for the infections specifically, we give you a course of antibiotics. Any bleeding from the cuts, if you have any bleeding from the cuts, we want to watch out for that too. So often it goes away with firm pressure with an ice pack for 5 minutes to the area of the cut if it's bleeding there. And if that doesn't stop it, let us know right away. Okay. Let's see. Okay, so that's what we watch out for, especially in the first 24 hours. So regarding work, I would recommend obviously taking work off for a day or two, and then most people go back to work within the first 72 hours, usually on day 3. At work, don't do anything too excessive. Take it easy during the day. If your job is very physical in nature, you might want to make sure you don't do too much regarding your chest to avoid any excessive swelling or bleeding. I definitely, and again, if you're going back to work, you should wear some sort of compression to help protect the area. But overall, most people are back to work within 72 hours without any issues. Now, regarding exercise, you can walk around the next day. You can drive just as long as you're not taking pain medication, because the pain medication may dull your senses and you can get into an accident. So please be very, very careful if you are driving soon after the surgery. Now regarding like chest exercises like bench press or push-ups, we should wait for about 1 month after the surgery for you to do any chest-specific exercises, because it can cause swelling. You are healing from the area. Some new blood vessels are forming. You can have some bleeding, and we'd like to avoid that. So for as much as possible, we'd like you to avoid doing chest for about a month, but you can do everything else: core, legs, shoulders, back, all of that regarding weight training. And so that would be our recommendation. Regarding cardiovascular exercise, keep it very, very light for the first 2 weeks, and after 2 weeks, you can start your routine cardiovascular exercise. However, you should wear your compression vest or your Under Armour garment up to a month for when you do your cardiovascular exercise, because what can happen is, as it'll cause you a lot of discomfort, because as you run, your skin may move up and down, and that may cause a lot of soreness or irritation of the chest. So you may have a lot of discomfort. So you should wear your compression shirt when you do cardiovascular exercise to help prevent that. Also, when you weight train, you should wear your Under Armour compression shirt or a compression vest as much as possible to try to decrease any type of swelling. Now, after the first 4 weeks or after the month, before you go back to full unrestricted activity, you will have an appointment with us at that time, or you should follow up with us at that time at around a month, so that we can check everything and give you and make sure that there's no issues or any problems. So after that 1 month visit, you can go back to working out chest and unrestricted. It's also really important to stretch, because you may develop scar tissue, and we want all that to loosen up. So stretching after that first month is very important. But other than that, those are our general guidelines. And again, for a great cosmetic result after the surgery, we'd like you to follow them as much as possible. If you have any questions, please feel free to email us or call us at any time. Yeah, we hope to see you soon at your first post-operative visit. So take care, and we'll see you soon. Thanks.